to Patrick.
Okay, thank you, Deanna. I believe I'm unmuted here, so please let me know on the chat if there are any technical difficulties here. I am also in a building where they are doing construction just outside of my window here, so definitely let me know if there's an issue with that. But I think we should be okay this morning. So as Deanna mentioned, my name is Patrick Scott. I am a physical therapist and currently an occupational health specialist at the University of Wisconsin-Madison. I was a physical therapist or a clinical physical therapist for about 6 years at University of Wisconsin Hospital and Clinics, specializing in orthopedics as well as primary care physical therapy. And only recently decided to make the change over to kind of an academic setting to focus primarily on how can we prevent injuries? How can we improve the well-being of our workers? So from a clinical practice, instead of being more on the reactive side of things, I have a passion and an interest in the preventive side of things. I got my Doctor of Physical Therapy at Regis University, at the University or in Colorado, and then I did my orthopedic residency here at the University of Wisconsin in 2015. So I'm going to try to share my screen with you, and please let me know if it is not showing up. Let's see here. Looks like I'm just struggling a bit here. Can you see my screen at all?
Not yet.
Not yet, okay. Let's see. How about this?
Not yet.
Still not yet, okay. Let's try this. And how about that?
We see it now. Thank you.
Okay, sorry about that. Okay. So the title of the presentation here will be Ergonomic Considerations for the Environmental Health Provider. Okay, and I have no actual or potential conflicts of interest in relation to this presentation. And here are the overall objectives and the general agenda with which we will touch on today. However, I'd like to encourage all of you to ask questions as they come up. And Deanna, if you see any questions in the chat, just kind of stop me in my tracks and we can answer them as we go, if that kind of works with the flow. I want this to be helpful and beneficial for everyone in the audience. And then depending on time, we'll save some time at the end of the presentation for Q&A. So really, what is ergonomics? We've heard that term tossed around over the years, but the International Ergonomics Association has defined ergonomics as the scientific discipline concerned with an understanding of the interactions among humans and elements of a system in order to optimize human well-being and overall system performance. Essentially, it is improving and maintaining employee workability, employee efficiency, and employee productiveness. Or as OSHA likes to say, it is fitting a job to a person, as opposed to what we continually think about as fitting a person to a job. And another way to maybe think about this is that ergonomics is a way to prevent injuries. And common injuries that we see include a variety of musculoskeletal conditions, can be caused by sudden or sustained physical exertion. So imagine lifting that 50-pound box from a floor, or even pulling down a 50-pound box from an overhead position. And really the most specific musculoskeletal conditions that we see on a regular basis include repetitive strain injuries. So we think of these repeated microtraumas that may occur over time, whether that's through typing, whether that is through our custodial individuals when they have to do repetitive bending and lifting of trash cans and so forth. But ergonomics doesn't only need to be concerned with musculoskeletal concerns and trying to mitigate these concerns with physical changes. Here at the University of Wisconsin, we're trying to take a more holistic approach. And I think this is probably the key message that I would like everyone to be mindful of as we move forward here, is that we want to understand that musculoskeletal injuries and really pain in general is more than just a physical event or a physical thing that has happened. There are also these other contextual factors, psychologic factors, cognitive factors, somebody's social or financial situations, other medical considerations that play a role into somebody's experience of pain. Essentially, there's a connection of these various human factors as well as neuroscience. Okay, so somebody who may be on their work today may have woke up late, may have gotten a speeding ticket, may have some other stressors that could be occurring in their life, and then suddenly they experience some type of pain at work. These other factors can play a significant role into that individual's overall experience of those symptoms. So why do we care? Why do we care about ergonomics? Why do I have the job that I have? And essentially, ergonomic related injuries are common in a variety of industries, whether that is in white collar positions, office positions, blue collar, physical labor jobs. Ultimately, we don't want injuries to occur. We want to maintain the health and safety of our workers. And when workers are feeling better, their overall morale is going to be better, which means they're likely going to be more productive in their work. And quite frankly, when people are feeling better, have higher morale, are more productive, the overall cost is going to be improved for business. And since the onset of the COVID-19 pandemic, a lot of individuals transitioned to remote work, although that is changing slowly now. But we saw with that change, there was a higher incidence, higher rates of sedentary work. And so how do we mitigate some of these factors? And that is where I come into play from an ergonomics standpoint. Now, when we talk about musculoskeletal specific concerns, what do we mean? What is going on here? And from a clinical standpoint, I struggled with this for many years. Somebody has shoulder pain or somebody has knee pain. What does that mean actually, other than they say they have pain? What I found to be helpful in conceptualizing this is thinking about musculoskeletal conditions, shoulder pain, knee pain, back pain, really as a discrepancy between the physical load or the workload that somebody has been experiencing, as well, and their overall capacity to withstand their load, or the tissue capacity to withstand that load. And it's a constant teeter-totter. And these physical loads can be anything from prolonged static postures or positions, awkward postures, heavy load, lifting that 50-gallon drum from the floor to the waist, or repetitive motions, typing all day long, mousing all day long. Individuals who are in a kitchen, some of our food service employees, where they have to chop vegetables repetitively. Those repetitive motions exert a certain physical load on joints and tissue. And how do those tissues, how are they able to respond to that load? And as we discussed before, there are these secondary factors, occupational stress, psychosocial factors that kind of play into it. And essentially, work-related musculoskeletal conditions have a multifactorial etiology. And we want to be mindful of that as we talk to individuals, as we help individuals try to mitigate some of these issues and these concerns, knowing that it's not always just this repetitive motion or this repetitive thing that I'm doing. there may be these other things going on in somebody's life that we need to help them with in order to fully mitigate these concerns. So something that we will work on frequently in our department is if somebody is having, say they have difficulties with repetitive lifting, whatever that would be. Well, maybe we figure out a way to decrease how much they're lifting. That could be either some weight restrictions or maybe decrease the number of lifts that they have in an hour. Maybe it is also changing how they are when their breaks are during their day. Instead of having 1:30 or 45-minute break, maybe we start splitting that up a little bit more into 10 to 15-minute chunks. Maybe it's implementing some mindfulness exercises, or it could be implementing some general exercises, stretching. So we can approach these musculoskeletal concerns in a variety of ways, and that's sort of the fun way in how we can interact with employees and other individuals. Now, with all that said, I think most of you kind of came to this presentation wanting to talk about some posture, what are the appropriate positions that I should be in at my workstation and then standing, and we're going to touch on that briefly as well. But before we do so, I want to just set the scene that there is no perfect posture. Everybody's a little different. Everybody's size, body, height, weight is going to be a little bit different. And we all have different contextual factors that are going to play into this. So I think another take-home point here is be mindful of how you're feeling. If you feel like you need to sit down, that's okay. If you feel like you need to slouch for a little bit, that's okay. There's not one perfect posture out there. These are the different types of postures that we will think about on a regular basis. We have the sway back posture, increased lumbar lordotic posture, this kyphotic forward head posture, and that quote unquote good posture, which I mentioned briefly, may not necessarily exist because everybody's a little different. The sway back posture, if you're in a grocery store, you may see some people doing this. It's sort of that leaning back type posture. And from a rehab physical therapy standpoint, this is typically a result of generalized core weakness. So when there's some core weakness in the abdominals and the glutes, somebody may lean back a little bit just to make their center of mass a little bit more lined up with them. And what they're doing is just resting on the bony apparatus of the spine in order to maintain an upright posture. Again, not necessarily a bad thing, but that may be one reason why they are doing that. So from a rehab standpoint, if I'm working with somebody like this, we might focus primarily on core strength as a way to potentially help with that. Somebody with a lumbar lordotic curve, you can see the second picture off to the right. These individuals tend to have their glutes sticking out backwards, their chest a little bit more prominent up front. And that can be due to multiple factors, tight hip flexors, but also they may have some anatomic variance. The angle of their hips or the position of their pelvis that just may be normal for them. And so if we're working with somebody like this, yeah, maybe stretching the hip flexors, those muscles in the front of your hips, or stretching the quadriceps would be helpful. We also want to be mindful, maybe this is just their body, and we don't want to push them too much. The thoracic kyphotic and forward head posture very frequently go together, and that's going to be more of the rounded shoulders type position, a little bit more of a prominent upper back. That can occur for people who are in sitting positions for extended periods of time. But again, somebody who might have a diagnosis of like Scheuermann's kyphosis, that might be maybe their normal posture. And so, yes, these postures are important to visualize and be aware of, but everybody's a little different. And we don't want to necessarily force a posture or position that may not be comfortable for them. When we're thinking about sitting, we've been sitting a lot over the past couple of years. I've seen people working at their desk, meaning working at their coffee table. And again, you could see this position where that's going to be more of this rounded upper back, forward head. These individuals can get some discomfort in their upper back. You can see the picture over to the bottom right. If they're working at a desk or a counter that might be a little bit too high for them, that's going to put their wrist when they're typing a little bit more into this position, which can cause some irritation in the wrist or the carpal tunnel. And as we've been talking about before, there's not great evidence to say that there is a perfect sitting posture, a perfect standing posture, or a perfect lifting technique or a way of doing a certain task. It's going to be different based on the individual because there's just so many contributing factors to musculoskeletal pain. Now, ergonomics in an office. When I'm working with somebody in an office setting at their desk, trying to set it up to maybe maximize the comforts that they have. Again, we want to interview the individual. What feels better? What doesn't feel better? Take that information in and apply it to the recommendations that you might provide. So from a chair standpoint, what can we do? Okay, so if we're working from home or if we're at our office, the general big picture things that I may look for are, where are those armrests? Are they being used? Does the chair have an armrest? If it does, we want that we would like to ideally have that armrest up to support the elbows at about a 90-degree angle. Again, this may not work for everybody, but this is at least a starting point for us. We want the arms to be, or the elbows to be at about a 90-degree angle. We want the lumbar support in the chair to line up with the curvature of the lower back. Some people, they might like to have a very prominent lumbar support. Others, they may not prefer to have that, and that's going to depend on what's going on in the lower back. Some people who have a history of lumbar spinal stenosis, they may not like to have lumbar support. That might irritate symptoms. So we want to just be mindful of that. So it's all based on your individual comfort. Seat depth. So what is the length of that seat? Ideally, we would probably want to see a couple of finger widths between the edge of the seat and the back of the knee. And that's going to prevent any type of compression of the sciatic nerve or vasculature in that area. And the seat height. We want to have that seat at a position that's going to allow the feet to rest comfortably on the floor. From a desk standpoint, how high do we want the desks? Now, from an office standpoint, most of the desks out there are, they still use dimensions that were from the 1950s. So most desks are too tall for people. They're about 29 to 30 inches tall. And the average height for males is about 5'7". For females is about 5'3". So that is too tall of a desk for most individuals. So how do we mitigate this? We can either elevate the chair by putting a footrest underneath the feet, so that will allow you to accommodate a little bit more to that desk. We can try maybe lowering the desk if that is an adjustable type desk. So in this picture, you'll see that the desk height, we want the desk height to align with the armrests of the desk so that your arms are not going uphill or downhill. And I know we only have a couple of minutes here. I'll go through this a little bit quicker. The screens, typically arm length away or a little bit longer, a little bit further. That's just going to depend on an individual's eyesight or whether or not they are wearing corrective lenses. Tilt, it's okay for it to be at a complete vertical tilt or a slight tilt. And we want to center it, position the monitor in your midline as opposed to off to the side, in which case then you're going to be rotating your neck repetitively and that can cause irritation at the neck. Monitors, we see a lot of people using dual monitors and that can be okay. But for individuals maybe with a history of some neck discomfort, maybe a better idea to position a primary monitor right in your midline, about arm's length away. Use the secondary monitor as a reference screen. So you have your primary monitor that you're doing 80% of the work. Your reference screen is maybe at a 30-degree angle, 40-degree angle off to the side, and you're only looking at that reference screen occasionally. That's going to decrease the amount of repetitive neck rotation that you experience. Laptops, I'll just say laptops are primarily meant for short-term use. When they're at a standard desk, that's going to promote more of this rounded position, forward head posture, a lot of ulnar deviation when you're typing. So if you have the ability to use more of a desktop monitor as well as an external keyboard and mouse, I would go that route. Okay, and I think these are some really nice pictures from keyboarding and mousing here. You can see the keyboard in the middle here. You can see somebody on a standard, on actually a narrower laptop type of keyboard where their wrists are gonna deviate a bit off to the side, and that can cause irritation in the lateral wrist, versus somebody who is keeping more of a neutral position in their arms or in their hands and wrists. And then you can see here on the right, where the hand is from a typing standpoint. Want to try to maybe keep more of a neutral position there for the hand and wrist as opposed to this wrist extension, which can cause irritation in the carpal tunnel. Try to keep everything close to you, something that I see a lot, either in clinic or working with individuals, is that people tend to have all their equipment far away from them. They're reaching for their keyboard, they're reaching for their mouse, as opposed to bringing everything close to them. We want to keep the arms roughly at about 90 degrees. And so scoot the chair close to the desk, bring the equipment close to you. That's going to prevent reaching. And I'm just going to kind of skip through this part because we can talk about that during the Q&A. Bending and lifting, as we touched on before, there's no best way to do things. And it's all going to be dependent on how you are feeling on a given day. Okay. We may hear consistently that bending, like the individual's bending on the left side here, is not great for the back. But with that said, in studies that have looked at this, that is actually a more efficient way for somebody to bend and get something from the floor. And so asking somebody to do that squat technique every single time is actually a less efficient way to do that. And that individual has a history of knee pain or knee osteoarthritis, that could irritate the knees. So a better approach may be changing it up consistently. Maybe bend a couple of times this way on the left if you're picking up something light. Maybe do that deep squat technique if you are picking up something heavy. It's really balancing out all of the different loads and forces during the day. Okay, and that's something that we mentioned before here. Okay, and then from a food service industry, we'll just go for one minute or 2 minutes here. If you are doing any type of visits to restaurants or food service institutions, take a look and see how people are doing things. How are they cutting some of the vegetables? How are they carrying the trays? This group of individuals has a very high rate of musculoskeletal injuries and incidences. They stand in one place for extended periods of time, do repetitive tasks, a lot of gripping activities. They're holding trays like this, which can put a lot of stress right on the radial aspect of the wrist, the decor veins issue. And so you may be in a perfect position to provide some general recommendations to these individuals. And some of the recommendations that I would suggest is support the tray with both hands. Use the forearm as opposed to holding the plate or the tray like this. Use cut-resistant gloves. That's an issue here on this campus. No reason not to use cut-resistant gloves. Carry items close to the body. Rotate job tasks if you can to try to disperse the forces that one is experiencing during the day. And then finally, general lighting recommendations. This can be a common source of headaches for individuals, just general eye fatigue. With the increased use of computers, this is an issue. And some of the general recommendations that I make for people is indirect lighting sources. Don't sit with the overhead light in your visual field. Have that above you or behind you. Sit at minimum 3 feet from a window and at a right angle. Use a monitor visor to reduce glare, particularly if an individual is dealing with recurring headaches. Adjust the screen brightness to match the brightness of your surroundings. Maybe consider changing the display polarity, and this is personal preference. Evidence is not great with this. Some people prefer black text on a white background. Other people prefer white text on a black background. I'm in the second category. If I looked at a computer screen with black text on a white background all day long, I would have bad headaches. So I've been able to flip that, and I don't get nearly as many headaches as I used to. Consciously blink your eyes regularly. When we're looking at screens, the blue light, it's the subconscious thing that'll happen, is that we're not going to be blinking very often. And essentially, so what can we do? Take micro breaks during the day. Try to rotate your tasks during the day. If you're looking at a computer, walk away for a minute or two. Remind colleagues about about different postures and positions. Provide recommendations if you see somebody who's carrying a tray like this. Exercise, 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 I think is super, super important. And I think the last tidbit here is exercise has been shown to increase the threshold for pain, meaning that it's going to take more of a stimulus to elicit that experience of pain. So exercise is a super, super important thing for us to be mindful of. Thank you very much. I definitely put too many slides on here, more than I was expecting. But this is a passion of mine, and hopefully this was helpful, and we'll open up the floor to questions and thoughts.
So for anyone that is brave enough, you can unmute yourself. Otherwise, feel free to put any questions or comments in the chat box. I'm just going to say, I know I'm probably not the only person that when you talked about blinking from staring at a screen, you know, I was like, oh yeah, I haven't blinked in a while. So that was my little reminder too. And I really appreciate a lot of those little tidbits. I noticed, oh, I do that when I'm typing. My hands are not in the right position. So thanks for bringing awareness to that.
Yeah, and you know, it's a topic like this is challenging because the research and the evidence just is not, it's not great. And you know, some people may not have an issue in their wrist and they can type and ulnar deviate all day, every day, not have an issue, and others are on the other end of the spectrum. And so I think the big point with a lot of this stuff is awareness. Be mindful of how you're feeling, be mindful of what we're doing. And your body's going to kind of tell you where you're at and if there are going to need to be changes made. And looks like Whitney had a question of any specific chairs or products that can help assist with improving our ergonomics at the office. I get this question every day, both clinically and non-clinically. And the unfortunate answer is going to be, as pretty much everything in life, it depends, right? It depends on the person. It depends on some of these other contextual factors. If somebody has a bit of a narrower profile, they may benefit from a chair that has a real narrow armrests. So there's a steel case gesture is a really good option for those individuals. If somebody has a history of spinal stenosis, a more plush, cushiony type chair may be more comfortable for them. If somebody has a history of maybe some disc-related pain in their low back, a firmer type of chair, maybe with a more prominent lumbar support in the low back, might be preferable for them. So there's not one chair that is probably going to be best for everybody. Brands, though, that I maybe would recommend, because they have different options, might be Steelcase is a great brand. Herman Miller as well. But the one thing with Herman Miller is that the depth of the seats many times don't change. And so you can't adjust it as much as somebody might need it to. So maybe that would be another suggestion. Another suggestion is that if you were trying to get chairs for everybody in the office and maybe keeping it simple, have chairs with armrests that are adjustable, not just up and down, but inward as well. So inward and maybe a rotation. So you have like 3 dimensions of movement, as well as the seat depth is adjustable. I think if you did those two, as well as height adjustable, I think if you did those 2 or 3 things, you're probably going to capture a majority of people that will eventually work with. Yeah, Herman Miller. I mean, I have a Herman Miller. I love it. But I have a history of 2 disc herniations, and so I like that firm feel and that more prominent lumbar support for my lower back. So that's good for me.
I have a question
Sure.
of, when I'm out doing my inspections, I have one bag that has my computer in it, and I have another bag that it's a little bit of a smaller, like satchel type size one that has all of my inspecting gear in it. I might have a clipboard or a notebook or something like that. Do you have any tips or tricks of how we can lighten our load as inspectors? I mean, I generally don't carry my computer around with me if I can help it, but I know a lot of people are going more to the iPad style, and they walk around inspecting with a computer as well.
Yeah, I think, the great thing about technology these days is, well, good and bad, I guess, is that we can have it with us a lot. And so trying to lighten the load as much as you can. So if that means transitioning from a laptop to an iPad or a smaller type of device, I think that's a great tool. And it will benefit you in the long term to take that time on the front end, even if it takes 2-3 minutes. Take out what you don't need out of that bag. If I'm not going to need the X, Y, or Z, just put that off to the side. Or if you can get by with just a couple of things, because in the long term, you're likely going to decrease discomforts and all the stress that's going to cause and contribute. So trying to lighten the load is going to be the best approach. The satchel type bags, I shouldn't say I have one of them. I like mine, but they're probably not the best. It needs to be positioned very close to the body, so make sure the strap is really close here. It's not dangling off to the side when it's good. In that case, it'll just kind of cause you to lean over. I am more of a fan of just backpacks and using both straps, making sure that's tight around the shoulders. You can get maybe a thumb underneath there. That should be a pretty good fit. And a bag that has maybe a cross strap either across the chest or across the waist. Those are probably the best things, but maybe not always the most fashionable. So I would probably lean that way.
Thank you. And then we do have another one from Leslie here. She said, thank you. She just adjusted her armrest on her chair. And do you have any suggestions for people who are getting in and out of cars frequently to avoid hip pain and back pain, knee pain, all of the above kind of pain?
Yeah, that's a great clinical question there. And I guess it depends on which hip, right? Are you the driver or on the passenger side? Is it both hips? And so that might play a role as well. That's a tough question to answer, and it could be if you're getting into a sedan or an SUV. The most important thing that I would probably suggest is go slow. Plan your movements. In this day and age, we tend to do things quickly and things need to get done. We need to be places. And a lot of times that speed is what can cause incidents, or I don't want to say flare-ups, but that can cause maybe an irritation. If you're pre-planning your movements, even if it's for a second or two, okay, I'm going to get one leg out first and go that way. That tends to, by pre-planning it, you're actually getting some early activation of the surrounding musculature of the limbs and the muscle and the move. You're going to get some pre-activation of the muscles around the joints that are going to be moving. And it's only milliseconds that we're thinking about, but that could be enough to help mitigate some discomfort. So I think the strategy here may be to pre-plan your movements carefully. Again, even if it's only for a second or two. If it is stretching can be beneficial beforehand. A lot of times getting into a car and driving for an extended period of time, if somebody has hip osteoarthritis or something like that, that sedentary position can irritate the hip. So actually maybe just doing some light stretching in the car, even if you're just stretching the calf or squeezing the glute muscles before you get moving, sometimes that can help maybe loosen up that joint before you get going. I don't want to ask too many questions about it, but without knowing the exact things that are going on, it's hard to give a specific recommendation, but those might be some general strategies that I would suggest.
Yeah, and if I can kind of think about my general day of, I come into the office, I sit here at my desk doing all of my emails and phone calls and stuff like that for a few hours, and then I jump in the car and go to my first stop. I might be driving for 10 to 15 minutes before I get to my first stop, that I'm walking around in the kitchen for an hour or so, and then I'm back into the car. But there are some days that you're getting in and out of the car very often. That could be something I've heard at one point. It's better to twist both legs out. Do you have any insight on that?
Yeah, and so depending on the individual, right? I think frequently pain is it's a result of some of these other contextual factors, but there is a discrepancy between physical load and what is our capacity. And so this day and age, a lot of us tend to have maybe a bit more of a sedentary job. And then so if we're, like you were mentioning, if we are at our computer for an extended period of time, then we're driving for an extended period of time, and then we're trying to get in and out of the vehicle, maybe the musculature around the hips, around the low back, may not be ready or prepped to withstand that load or that activity. So that's where these micro breaks come into play. A minute or two, stand up at your desk, stretch, do some little squats, just do some exercises with some bands or whatnot, just to kind of prep those muscles for any activities that you might be doing later on in the day. As you mentioned, trying to get in and out of the vehicle. Twisting at the pelvis could be beneficial for the hips, but that could be irritable for the low back. And so it all depends on how you are feeling. So for Leslie, if it was more of a hip thing and not much back issue, maybe focusing on, okay, I'm going to try to swing my hips or swing both legs and rotate through the pelvis to get in and out of the car. Maybe that'll feel excellent for you, and that would be a really good strategy. But if somebody has more of a back issue, maybe for them it might be, okay, I'll open up the door and I'm going to get one leg out and keep that back straight and just slide the hips out this way. So it's very individualized.
Wonderful. Thank you for that.
Mhm.
Do we have any other questions before we wrap up for this month? All right, I'm not hearing anyone chiming in, and I'm seeing that the chat box looks like it's slowing down there. So thank you, Patrick, for all of your insight. It was really good, and now I know I need to kind of check myself a little bit more throughout the day.
You are very welcome. And I guess the last take home message is be mindful of how you're feeling. If you're feeling good one day, that's excellent. If you're having a little discomfort one day, that's okay. Things change. But yeah, pay attention to how you're feeling and try to take micro breaks during the day.
Thank you, guys. Take care.
Thank you.